This is Sarnia Lambton Daily for Tuesday, June 16th. Good evening, I'm Terry Doyle. There is an old line that sometimes no news is good news. And in the case of the COVID-19 pandemic, today's news in Sarnia Lambton is that there is nothing new to report. Things are currently status quo. The number of positive cases remains at 276, with 25 deaths and 233 people recovered, leaving 16 active cases here. The only remaining active outbreak is at Vision Nursing Home, but public health officials are hoping that the outbreak could be declared over soon if no new cases are found. As Sarnia Lambton moves into stage 2 on Friday, one of the ongoing debates is whether or not to wear a mask in public settings, such as grocery stores and retail outlets. The Ontario Minister of Health and the Premier weighed in on the topic today.
The guidance and recommendations we've received so far from the Chief Medical Officer of Health, as well as the other public health experts at the command table, is that the physical distancing is still the most important rule to follow, that we should continue to do that for the foreseeable future, and that masks should be worn in situations where that's not going to be possible. Perhaps in public transit, perhaps in some retail establishments that are quite close, where it's impossible to achieve that physical distancing. But the physical distancing is the most important rule. The masking follows in situations where that's not possible.
We want to work with the retailers. We don't want to force anyone to do anything. I highly, highly recommend when you go out, wear a face mask of some sort. It's as simple as that. You're going into a store, wear a face mask of some sort. I know two big retailers are asking people to wear them, or you aren't getting into the store. So I think that's a good policy.
We know during the pandemic it has been busy times for many charitable organizations throughout Sarnia Lambton. Three of the busiest ones we've dealt with throughout our time here at Sarnia Lambton Daily have been the Inn of the Good Shepherd, United Way of Sarnia Lambton, and Bluewater Health Foundation. There's Cathy Alexander joining us from Bluewater Health Foundation. Cathy,
hi, Terry.
Hey, how are you?
I'm okay, thanks. How about you? It's good to see you.
Pretty good. Good to see you as well. And I've got to think, we were talking before we even came on here. We go back to March when this all rolled out. It was winter. Now it's nice outside. It's been 13 weeks, I believe, of this. Take me through what comes to mind when you think back to when this all started.
Yeah, well, I think it's unreal that it's been 13 weeks of, a new normal, a very different time for not only charitable organizations in our community, just for folks that live in all over the world. So we've had to really learn and transition and come together in ways that I think we never really thought would happen. So it has been, it's been bittersweet. It's been a pretty remarkable time in terms of the incredible generosity and support that, as you mentioned, some other charitable organizations have been receiving as well, but Bluewater Health and Bluewater Health Foundation, the community outpouring of gratitude and support has been overwhelming, to say the least. And it's been a real privilege for myself and my team to actually be involved in this process where we get to hear these incredible comments and stories and messages of hope and appreciation for those people that are giving their time each and every day to deal with and respond to the COVID pandemic at our hospital and our community. So it's been interesting, that's for sure. And I keep feeling like, is the groundhog going to see his shadow? Like what's next? What can we really come up with to keep going forward? But we're getting ready for some very different times ahead. And I think that Bluewater Health Foundation really, we've had to shift some of the work that we do. We'll continue to shift as we look ahead to the days and the weeks and the months and the year ahead in terms of the work that we do and the special events that we host. It's going to be very different as we look ahead.
You go back to March, and of course, most charitable initiatives and fundraising events take weeks and months to roll out in a lot of cases. There's an idea. How is it going to go about? In this case, I'm going to guess it was probably about a 48 to 72 hours. Away we go.
Absolutely. It was something that we really just, we were being, I guess you could say, inundated with opportunities and people wanting to give back and acknowledge and say thank you through financial support and also through messages of appreciation. So we decided that we needed to launch this COVID-19 emergency response fund. And like you said, we did it quickly. There wasn't a lot of time or opportunity to really do that behind the scenes legwork that we're used to, but it's been pretty remarkable. We've raised almost $350,000 through that fund, and that's through corporate donations, individual donations, and lots of great initiatives happening, hosted by people in the community, bottle drives, the big bites through the Grand Fondo. They had to postpone their incredible race this year and use that opportunity to encourage people to instead give to the foundation to support meals for frontline workers in our community. So it's just really been a great showing of community coming together. And I think I go back to what you said earlier, Terry. We live in a community, Sarnia Lambton, that has many charitable organizations that rely heavily on fundraising and donations and special events. And we know we're not the only ones. We know we're not the only ones in a very precarious situation looking forward. But time and time again, we just continue to see the people that live and call Sarnia Lambton home really rather rally together to support charities. We're seeing them support local businesses that are also having to redo the way that they do day-to-day business. And again, I think we just feel a really strong sense of gratitude to the people that continue to support Bluewater Health, and also just supporting Sarnia Lambton at this time when so many people are challenged with difficulties.
And Cathy, I know in some cases the money from the fundraising was immediately turned around into some equipment. Just to maybe give us a recap on some of those things it was able to be used for right away.
So it's, again, been very quick. I think COVID-19 really, there was a lot of decisions that needed to be made quite quickly, which is also why we put this fund in place to really be able to respond and help the hospital support staff and physicians and patients. And we were able to purchase, through the support of the community and donors, a new ventilator. We've been able to purchase a specialized sterilizer for PPE equipment. We've been able to also do other things with respect to the purchase of PPE, hand sanitizer, things that were really going through some global shortages at the time. We also got donations of PPE from many businesses and folks in the community, these amazing people that would call me and say, I've made 10 masks, I've made 1,000 masks. And every patient's gifted a mask as they come into the doors of Bluewater Health. And that's because of generosity in our community. We've been able to buy many iPads. We've also received donations of iPads, really keeping families connected. We know it's a really difficult time for, when there's visitor restrictions and not being able to be with your loved ones. So the amazing staff have been able to connect virtually families and patients so that they have time to be together. And something else that we've been able to do with the support of donations is actually helping staff that need to self-isolate to pay for their accommodations. And that's something we would never want staff to feel like they need to pay out of their pocket to ensure their safety and well-being. And again, community support has allowed us to do that. And then also some other things we have purchased is, program supplies. There's been a demand on some of our other departments. We've been able to buy art supplies for the mental health and addictions program. Again, no visitors makes things a little bit difficult for a lot of people.
Cathy, all the attention's been on COVID, but I know at the hospital there are patients dealing with, of course, other ailments as well. And I'm sure when you talk about bringing in tablets because of no visitors and the staff having to deal with those people as well, I'm sure that's where everybody's come together. And we put so much on the COVID side of it, but everyone there working together and showing that care and compassion.
Oh, absolutely, Terry. I think that the response from the entire organization has been very collaborative and very filled with kindness and caring and compassion, and definitely that connection between families and patients, and those donations that have come in are for use across the entire organization. So we know that there are also patients that Bluewater Health is their home. So they haven't been able to have visitors for, like you said, months, and hopefully that will start to ease with the with the new movement and going into stage 2 tomorrow. I think that there's new decisions and opportunities every day, but the continued safety is so important of our patients and our staff and our community. So anything that we, from a foundation perspective, can provide or purchase that will keep people safe and connected. I think we're seeing a lot of use of technology, and it's really a great way to keep families connected. I know in my own life, I've actually started doing, in the last 3 months, I've had more Zoom calls and Facebook Messenger chats with my sisters across the country and our friends. And it's something that, COVID definitely is keeping us physically apart, but I think those connections need to really continue to happen. So the entire organization at Bluewater Health really needs to be commended. And I think the community really recognizes that. And I think that's part of why the COVID fund establishment was just so successful and essential was people were reaching out and saying, how can we help? What can we do to say thank you? And Sarnia Lambton overwhelmingly has said thank you. And we're truly, truly grateful.
What's it been like for your team over the last 13 months, I'm sure, or 13 weeks? That sometimes feels like 13 months. For the last 13 weeks of, the fact that, of course, relying on technology, phone, Zoom meetings, things like that,
Yeah.
when you're used to being a team there in the office.
Well, and I would say that so much of philanthropy and fundraising is really based on relationships, and that face-to-face meeting is so important in those connections. But I think my team is amazing, so I really want to give them a shout out. We're a small but mighty group of 5 people that typically have daily touch points in terms of being in the office together and just visiting and talking and brainstorming. And we've all had to go up against working from home. And some of us are working from home with little ones, and others are working from home with teenagers, which sometimes might be a little bit more tricky than working with those little ones, maybe. But they've been amazing, and they've really responded to the challenge and the opportunity of what we can do differently from our virtual offices. So we have regular staff meetings and regular touch points, and I think not unlike many other businesses, we're actually seeing that this may cause a shift in some of the traditional work that we do, and looking at things from a different perspective. And like I said, different opportunities might exist because of this. But Zoom meetings have become the new norm. But definitely, my team and I are craving the ability to be together in a social setting to have conversations and ideas. And especially as I said, we're looking forward to a very different time for fundraising and philanthropy. We've seen and heard many cancellations of events, and many of us rely heavily on event revenue to be successful in our efforts and our fundraising priorities. So from a foundation perspective, we're starting from scratch with respect to some strategic priorities and looking at a year ahead without any revenue likely coming in through many of our traditional events, and also then looking at different ways we can think outside the box to be innovative. And the COVID fund has been incredibly successful, but I also really want people in the community to be aware that we have many needs at Bluewater Health that will continue post COVID, and we rely heavily on the community for their support. And again, they typically are wonderfully creative and supportive of the work that we do. Without our community support, we wouldn't have so much of the incredible state-of-the-art equipment that we have in Sarnia Lambton, from mammography machines to CT scanners and so much things. We actually just announced earlier today an incredible fundraising success with partnered with the Mike Weir Foundation, and Bluewater Health is part of a partnership with St. Clair Child and Youth and CMHA for a youth access open minds facility. That is another priority that we're working on, and that's something we've been continuing to work on behind the scenes throughout COVID. And again, virtually, we've been having these amazing meetings with youth across Sarnia Lambton. But the work continues, but the work will likely continue in a very different way than many of us are accustomed to.
Yeah, and that's the thing. We know Bluewater Health right now, as of today, 0 COVID patients. Maybe there is that feel of turning the corner, but I guess at the same time, it's still the need is there. Whether, of course, COVID's not done. We know that's still an ongoing thing. But do you find that's where indeed it starts to feel like, rather than the scramble a little bit off the bat and the sprint off the first part of it, now kind of easing in, or maybe adjusting to that new normal when it comes to, as you said, normally, of course, people look for the dream home lottery coming up in the fall and things like that, where you have to plan to say, what can we do, what can we not do, depending on physical distancing, social distancing, the restrictions, all those things. I've got to think that's the new normal, is now adjusting to what was some of the previous normal.
Absolutely. And I think one of the many benefits is summer typically is one of those times, and I don't want to say it's less busy, but we don't typically have a lot of major events throughout the summer. So my team and I will have that opportunity to really strategically look ahead and plan for what that new normal will look like in the absence of physical events, moving to potentially virtual events. Can we host open houses for a dream home lottery? We've seen some lotteries in other communities launch through COVID, and they have not been able to have any open houses. And there's new rules and regulations with respect to, paper tickets and things that many people in the community are accustomed to. So I think that we're all going to learn together, and I think we're all going to, that there's a strong sense of community and collaboration in Sarnia Lambton. So I think the charities that really rely on the community support will work together and learn from one another, and speak with each other. Hey, I saw that you did this and it worked really well. What platform did you use? How did you successfully run a online gala? Things like that. So hopefully there's continued opportunity for conversations and collaboration between charitable partners. Of course, we're all competing for funds from the community, but at the same time, we know that historically this community has been able to support many important causes in our community, and we know that they'll continue to be able to do that. But I also think it's important that we recognize the incredible local small businesses and large businesses in Sarnia, Lambton, that have continued to support so many charitable causes in Sarnia, Lambton, and many of them, while their own doors have been shuttered. So I think that as a community, we really need to thank and pay tribute to those local businesses and kind of pay it forward and recognize that they're helping us as charitable organizations, so that when things really do start to open up, we want to make sure that our local businesses are celebrated and acknowledged, because we can't do it without them. And that's something that we're really grateful for, is the incredible support of business and industry in Sarnia and Lambton. And so many of them have stepped up to the plate to support not only Bluewater Health Foundation, but so many causes during this time that have affected so many of us. And like you said, Terry, we're cautiously optimistic that there's some openings starting to happen. My staff and I are able to start looking at opening, going back into the hospital location. But again, how that will look exactly from a traditional perspective, we're very aware and cognizant that things may look very different as we plan for the future.
Still going on right now is an online 50-50 with a partnership with the Sarnia Sting.
Yes, yeah. So again, another example of great partnership in the minor hockey league, and Sarnia Sting. They're really great to support us. They've always been really good partners. So the pot is getting bigger and bigger every day. So we do encourage folks to buy a ticket if you're able, and support the COVID fund at Bluewater Health. And it's a great partnership. We're thankful to the Sting for thinking of us, and to the Sarnia Minor Hockey for thinking of us as well. And again, I just like to add on that there's been many people thinking of us, that again, I can't name them all on your show because I take off all of your guests, but there's so many of them. But we've had wonderful youth in our community. We had a young girl that hosted a cupcake bake table from a safe social distance and raised money for us. It really does take a village, and I know that we've had so many different stories and experiences of people, contributing so many different ways to our hospital, and it's just really something that we're really proud of and we're really thankful for.
Well, Cathy, we appreciate the time. We know it's been a busy time. We've had these regular check-ins. I know it's certainly been busy times indeed, working from the home office, as things have certainly been, from the home office all through Sarnia, Lambton. It's been very busy, but, certainly kudos to you and your team and everyone coming together. And stay safe, stay well. We'll talk to you again soon.
Thank you. Thanks so much, Terry. Take care.
There's Cathy Alexander, Bluewater Health Foundation, joining us here. Stay tuned. You're watching Sarnia Lambton Daily on your TV. Welcome back to Sarnia Lambton Daily. During the pandemic, we know mental health has been a big factor for many people, and the importance of reaching out if you believe you are dealing with mental health challenges. We get more in this report.
Hi everyone, I am Justin the therapist. I am a registered psychotherapist qualifying. That means that I am a professional therapist in Ontario. And I work with individuals, with couples and families. And before the coronavirus, I used to see clients in Mississauga and Guelph, but now I help lots of people over video or phone chat. And today, I'd like to talk to you about some mental health tips that you can use so that you can take care of your mental health during this pandemic, during this quarantine, during this very, very difficult time. So let's begin. The first tip I have for you is probably the most important thing. If there's anything you're going to take home from this, it's this one, which is that if you notice that you're feeling down, or you're feeling depressed, or you're feeling really, really worried about yourself, about maybe your health, maybe about other people's health, if you're overall not feeling as great mental health wise as maybe you were before this pandemic, I want you to know that that is normal. That is okay. It makes sense to feel not okay. It is okay that you are not feeling okay. Allow yourself to also grieve, because there's a lot of things that we're all losing. We're all losing the ability to meet in public, meet in person with loved ones, Maybe there was a concert you wanted to go to, or a vacation you were planning on looking forward to, or maybe something much more serious happened. Maybe you are affected health-wise, or maybe you've lost someone to COVID-19. I want you to allow yourself to grieve. It is okay and sensible that you are upset at what you've lost. Now, of course, that is very helpful, but there's other things you can do to feel even better during this time. So what I really want you to do is to take care of yourself. Now, one thing you can do is to limit how much you're exposed to the coronavirus news. So we are so exposed every single day, 24/7. You can hear about the coronavirus, about COVID-19, about different press conferences, different news coverage, maybe even things that you read on social media. That can become overwhelming when it feels like the entirety of everything that we're consuming has to do with COVID-19. So one thing you can do is simply notice the positives that remain in this world. Even though the world has changed so much, it can be helpful just to notice that it's still sunny outside some days, and there are wonderful people out there that are helping each other. And even though everyone feels like they're at home, the world is still running and people are still doing great things. And that brings me to my next point, which is connect with people as much as you can. So although it's called social distancing, I think that's a bit of a misnomer. It's more like physical distancing. We don't necessarily have to be distant from each other socially, just physically. This is a time where I encourage you to reach out as much as you can with others. In fact, this can actually be a time where you reach out with people that maybe you haven't spoken to in some time, or maybe you can have some heart-to-hearts with people that you haven't had with in a long time. Maybe you're at home with your spouse, your kids, maybe grandkids, maybe even parents. The reality is that we are extremely social beings. Our species is the most social species in the whole planet. We are not designed to be socially isolated for long periods of time. The next thing I can recommend is to create a schedule, to keep up with a routine, whatever it might be. It will make a big difference for you. We can get trapped in the sense of, we're just stuck at home. So you know what, whatever I can do, I can just do it tomorrow. And that can lead to feelings of sadness and hopelessness and despair and depression. But if you keep up with a schedule and make a routine, it can really lead to a lot of activity. And that can be really good for our mental health, including physical activity. Our minds and our bodies are so connected. So doing some physical activity can really help release those positive, good feeling hormones like endorphins. It can make a tremendous benefit for your mental health. And if you're stuck at home, there are plenty of videos you can watch online to help you exercise, videos that can help you if you have no equipment even. The other thing you can do is to go outside. Now, of course, it's very important to be safe and not necessarily congregate or go to public places, but even just stepping outside of your home can make a big difference to just get some fresh air.
Stay tuned. You are watching Sarnia Lambton Daily on your TV. That will do it for Sarnia Lambton Daily for this Tuesday, June 16th. Thank you for joining us. We will see you back here tomorrow.